Hey everyone, my name is Megan and I'm a neurosomatic therapist over at St. John Clark Pain Treatment Center, and I would like to talk to you about meniscal surgery and how to possibly avoid it if we can. Now, meniscal surgery is the most common orthopedic procedure in the United States, which means a lot of people are having trouble with their knees. So I would just like to explain to you a little bit about the joint, the surrounding joints, the body mechanics, and see if we can't avoid this common orthopedic procedure. Alright, so the knee is a simple hinge joint. It allows for one plane of motion with something we call flexion and extension. So that's bending and straightening. The knee does not allow for any rotation to happen, nor any diagonal movement like this. So the knee rests between two other joints that it's extremely dependent on. This is a ball and socket joint, the hip joint, the acetabular femoral joint, and it allows for the most movement of any type of joint in the body. Your arm is also a ball and socket joint. Moving down the leg, you have the ankle joint. So the ankle is supported by your three arches and dependent on hundreds of tiny little ligaments to keep it in place. So the ankle, for instance, if you were to roll out, now you're in a bad position that the knee is not supposed to be in. Were you to roll in, a lot of people have very pronated feet or flat feet. The knee is again in a very poor position to perform its task. The misalignment in either your hip or your ankle cause an increased pressure in your meniscus, making it more likely to tear. A simple test to see if this is related to your own knee issue would be a squat. So go ahead and stand in front of a mirror. I want to perform the squat test. Go ahead and squat down, and I want you to notice, do your knees track medially or laterally? Then I want you to stand up and just look at your knees as you're standing there. Are they pulled in towards the midline a little bit, or are they away from the midline? Now I want you to go ahead and have a look down at your ankle. This is a position that we call supinated, or is it pronated? Or is it possibly just flat? Do you have an arch at all? These are all factors that can influence the mechanics of your knee and should be addressed. As a neurosomatic therapist, we look at all of these factors and try to figure out where the pain is best coming from and how to fix it with conservative treatment. If you're looking to avoid surgery or have had surgery and still find yourself in pain, this may be a route for you to consider. Essentially, though, we believe in preventative care. This means not letting a twist of the ankle or a fall ruin you down the road. A body in alignment functions optimally. It does take some work to get there, but a pain-free life is worth it.